another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today my guest is a very good friend of mine and colleague, Dr. Nancy Gahles. Dr. Nancy Gahles is a chiropractor-certified classical homeopath, registered with North American Society of Homeopaths, an ordained interfaith minister, freelance journalist, integrative healthcare consultant, author, and lecturer. She has served as president of the National Center for Homeopathy and is on the board of directors for the Federal Policy Committee on Integrative Healthcare Policy Consortium. Welcome, Dr. Nancy.
Thank you, Dr. Laura. I'm very pleased to be here today.
Thank you. I am excited to pick your brain and learn more about how women can use homeopathy during their pregnancy and birth. So if you could please tell me a little bit about what classical homeopathy is.
Yeah, classical homeopathy is the practice of the art and the science of individualizing a remedy to fit the totality of symptoms that a person presents. So the laws of homeopathy are, as set forth by Dr. Samuel Hahnemann, base the selection of your simillimum on clearly realizable principles. So that means that a practitioner will select the remedy that most closely represents the state the person is in at the time they come to you. And this is called the simillimum. So the beauty of homeopathy classically presented or classically prescribed is that you can treat that person specifically with the state they are in. So we take the totality of symptoms, all the symptoms, body, mind, emotion, and spirit. It's quite different from allopathic or conventional medical prescribing. If you say you have nausea, there's one drug for nausea. When we say, do you have nausea, who are you? Who is experiencing that symptom? And what does it look like on all levels? And the reason why we prescribe this way is so that you personally not only get rid of the nausea, but become healed from the susceptibility to have that symptom this time in pregnancy or any other time in your life. And so when we prescribe on that individual person for all of the state that they're in and the totality of symptoms, we can also watch how does healing occur. When we give that particular specific intervention, how does your organism reorganize itself? As we watch the healing process, we see who you are, more and more revealed. How did you do it? Because in the finding of how you watching or observing of how you heal, we also know how you got there. So that the next time this happens or something similar happens, we understand your process. So we know that disease or symptoms are a dynamic state, not a material state, and health is the same way. Pregnancy is a state that you're in. It's a specific state. It's not a disease, of course, but it's a dynamic state that has a beginning, an end, and a continuity. And during the process, symptoms may occur. So when we treat classically, we're with you in your particular process, and yours is as unique as every snowflake or every fingerprint, and it's not the same for every person. How you are pregnant is how you are pregnant.
I love that. So really it's like cures like.
Yes, we look at the state that you're in. We take all of those symptoms and we look in what is called a materia medica, of a pharmacopoeia of all the remedies that have proven research. Proven is what we call it, provings in homeopathic literature. And so we look through all 2,000 to 5,000 remedies and we see which remedy looks like this. And then we prescribe that. So it is like cures like, yes.
That's so cool. I love, too, that homeopathy is non-toxic, so it is a really safe remedy to utilize during pregnancy and for birth.
Yes, what I love so much about it is that it is able to, again, correct the state that you're in a gentle, easy way. It's not material dose, so you're not giving something that has side effects or that can interact with anything else. It's an energetic principle. This is one of the areas in homeopathy that makes it a bit mysterious as to how it works, but we do have the nanoparticle theory, and Luc Montagnier won the Nobel Prize for discovering a proposed mechanism for how homeopathy works, as did Rustum Roy, and many others have proposed mechanisms of how it works energetically and physically altering the water molecule. So we do have some proposed mechanisms, but what we do know is that it works on an energetic state. And in that way, it's a higher level of vibrational frequency so that it doesn't work on the material or interfere or have any side effects on the material level.
Mm-hmm. So cool. So could you tell us a little bit about some uses of homeopathy with common pregnancy symptoms?
Certainly. So the first thing that usually occurs is morning sickness. That's how we know we're pregnant, and that's how we know it's a good pregnancy. And everything in pregnancy and the continuous state of pregnancy has to do with discrete and overt hormonal changes. We are a factory powerhouse. It's a glorious miracle of what happens to create another human being.
Mm-hmm.
Is always awesome to me in the true sense of the word awesome.
Such a miracle.
And what we're looking at is not just, we tend to look at symptoms as, oh my God, that's bad, that's wrong, that's, oh, I'm not, I'm having discomfort is bad. No. What we're doing is growing a human being. And when you do that, certain effects happen. Your body is different, and it has different sensations as you go along. It's not bad. It's good. If it is very uncomfortable and you can't tolerate it, then you want to help the body, assist the body through that process. That's what we do that's different from allopathic medicine. We don't suppress the symptoms or take them away or squelch them down. We assist the body in the process. So morning sickness is just the same thing. It's telling us there's a surge of hormones, and it's creating this feeling of nausea. And so, again, we prescribe very individually. We have different remedies, and what we do in homeopathy is we look for what we call modalities. That means, for instance, is your nausea better when you're in a open air? Do you feel like you want to get out and get some fresh air? See, I'm so nauseous. I got to get outside. This room feels so stuffy for me. I can't bear to be in a closed environment. I have to get outside, and I really want something delicious, like rich and sweet and fatty and yummy. But if I have that, I get worse. That would be indicative of a remedy called pulsatilla. And pulsatilla is a plant. And it really brings on this exact type of symptoms. And they're very weepy, clingy, changeable moods. 1 minute you're good, 1 minute you're bad. Also, if people who are pregnant have this symptom in morning sickness, this type of morning sickness response, they may have had this type of feeling as a premenstrual symptom as well. They might be the kind of person who said, oh, I used to get nauseous or very weepy or very moody before I got my period last time. Then you know you are in the similimum range, you are in the constitutional range. It's wonderful because you're going to preview this woman for her postpartum weepiness and mood changeability as well. So if it works, if she gets morning sickness and it fits that picture, you're looking at this is her susceptibility to hormonal changes in general. It may even be her menopausal symptom. So that's constitutional classical homeopathy. There are other morning sickness remedies, and they will look, again, like your individuality. So, for instance, ipecac is one. Ipecacuanha is one that we use when you have that severe, constant nausea, even if you wish you could vomit and it will go away, but it does not. If a lot of salivation, if you really feel like you must vomit, and you do, but it does not go away. That is a wonderful sign to use ipecacuanha, which is not ipecac that you find in the drugstore that makes you vomit. It is a homeopathically prepared, diluted remedy. Homeopathic remedies are specifically prepared so that they don't have that material dose. So you don't want to take ipecac in the drugstore, but this remedy is a very big one for that horrible nausea that nothing will help.
There's a few other remedies too, right?
There are many remedies, as many as people, but that one is, those two are my particular go-tos because they're the most strongly represented. The two other ones that are always represented in pregnancy in general are sepia, which sepia is a very big female remedy and really important hormonal remedy and very important in pregnancy because it has a very particular bearing down sensation. This is that feeling that your contents of your abdomen, your uterus, your vagina are bulging out. They're pushing down. This creates varicosities as well. So those may be in your totality of symptoms. They will say to you, listen, I have nausea that's so bad I can't even smell or think of food. It makes me sick. Almost I could faint from it. That's how bad the nausea is. And the feeling of the pressure in my abdomen pushing down, and I do have varicose veins or hemorrhoids, then that's a good indication for sepia. Sepia also, they crave pickles, vinegar, and they'll tell you that. You do want to look for cravings in pregnancy, and any time during pregnancy you want to see what cravings they do have. Always, the key to practitioners who are listening to this or consumers is always inquire more deeply into the presenting complaint. Not just I have nausea. What kind? How does it feel? When do you get it? And what makes it better and what makes it worse? And particularly to all homeopathic questioning is what is strange, rare, or peculiar about this symptom. That, I have to have pickles, I have to have sauerkraut, I have to have vinegar on everything. I drink vinegar out of the bottle, I've even heard. Then you know, sepia. Yeah. And sepia actually has to keep moving all the time. They're the people who are dancers. They like to get out and dance and shake it around. They're very bad for non-exertion. And so when they are pregnant and they can't do what they used to do, that makes them very upset. That's something that is typical of sepia. They have that contradiction between occupation and not. Like, I can't go to work, I can't do it, oh my God, now I can, I'm sidelined by this pregnancy, I can't do what I used to do. So that's an indication for sepia. That's an emotional thing that they will tell you, in addition to the other modalities like vinegar or varicosities or the smell of food. The other one are the... Go ahead.
So I was going to say, I think it's so fascinating how the physical symptoms correlate with the emotional symptoms.
So what do we know? We are not just a body. We are spirit in the body living. Yeah. So we know that we are emotional, we have sensation, and we have function, right? We have this in chiropractic as well. We have movement, and we have the sensory systems, and then we have the stuck place, which represents as a bodily, but it can represent in your mind as well. Wherever you're stuck is where your symptom is going to be. Mm-hmm. So, of course, if it's stuck, we have it in the body in pregnancy, of course, you know that. You're a chiropractor. They're going to come to you for back pain. That's their stuck place. For, right? So in sepia, for instance, they have that dragging. Remember, sepia is heavy, dragging, tired, exhausting, nagging, low back pain. Heaviness, bearing down in the pelvis, of course your back hurts right there. So then you're going to look at sepia for that. So they may come into you as a chiropractor with that presenting complaint. They may not come to you as a chiropractor with morning sickness. They're going to say, my back is killing me, I'm pregnant. So you're the portal of entry that's going to see it from that lens, and then you're going to build it up from there and say, and what else is happening with this?
What about like even pelvic floor discomfort during pregnancy?
So pelvic floor is very indicative of sepia because everything in pregnancy is hormonal. So what is going to happen is hormones are going to dictate muscle and ligament laxity. Because we have to relax everything in the pelvis and the low back and the abdomen so that it can open really wide and facilitate the growth of this baby, and then it has to push it out, an opening in the pelvis. So you have to relax all the ligaments, all the muscles, so it can open. So when you do that, you start to breed a little bit of instability and lack of support in that area. So that's where they will go to a chiropractor for, to keep realigning. I find sacral, of course you know that, sacroiliac, primary subluxations, as their susceptibility is surely going to show up if they have a sepia case where the laxity feels overbearing for them. The sagging of the muscles feels overbearing for them. It's too much. Feels like their insides are going to come right out. That is an indication for sepia.
And if a woman is taking these remedies, like she can pick them up maybe at a health food store?
They are available in Whole Foods now, and in fact they're available in CVS and in Duane Reade in 30C or 6C potencies. The lower the potency, the easier it is for you to monitor it more frequently, so you can take a dose and say, okay, this helped, or it didn't. The interesting thing that you should know about dosing with homeopathy is that it's not like conventional medicine or allopathy. In fact, every time I'm going to say this, homeopathy is a whole system of medicine, completely different from the system of medicine of allopathy, and it has its own medicines that are in the pharmacopoeia of medicine, FDA approved. It's not the same at all in philosophy or application. So we are used to one way of, okay, I'll take it, and I'll take it 5 of 10 of them at once, and I'm going to take it 7 times a day. No. In homeopathy, what we do is we do one intervention to the organism. We give it one time, and how does the body react to that over a period of 1, 2, 3, 4 hours? Normally, you might find it act immediately. That's the other miracle. Sometimes that's how I found it with my son. He had colic. You know, a colic, they cry, they scream. You think you're going to kill yourself with that baby. Nothing you do will help. I gave him colic tablets. I put it on his tongue. Immediately he stopped. Immediately.
Wow.
What is this? That's how I began. And in fact, I did recommend it to my sister-in-law at one time for her baby. And the baby stopped immediately and went to sleep. She thought she killed him. But that's how quickly it goes. And often what will happen is you give the remedy, and they do fall right asleep because it's a calm, soothing remedy. And we know that sleep is healing. That's a sign the body is reorganizing and restoring itself. So to backtrack, what you do if you're going to take it yourself is I would certainly read a book about it, consult with someone about it who is in the know, and because eventually you want to be able to, for self-limiting conditions yourself, and you can. It's a self-care modality as well as a professional modality. That's why I love it so much. So what you'll do is you'll take one dose, and then you'll watch what happens. And then you'll say, where did it impact me? Mind, body, emotion, spirit. Which one of the totality of symptoms do I feel it mitigated, it relieved? Which thing? And then we look at that, and then if it took the nausea away, but the nausea comes back in 4 hours, then you take another dose. Now, a dose is anywhere from 1 pellet to the whole bottle. What this means is it doesn't matter if you take 1 pellet or the whole bottle at one time. It only matters in repetition. So in allopathy, you can't take 3 or 4 ibuprofen or the whole bottle. Then you overdose. In homeopathy, that is not true. It doesn't matter. It's only one intervention to the body. Then repetition is the key. So if you take it and take it and take it and you're never getting any relief, then it's not the simillimum for you. And then you go back and say, okay, let me look at the totality again. What have I forgotten? Is it better in the warm? Do I really feel like I want to go outside? Do I feel like I have to sit there and take my shirt off? I'm so hot. I feel like I'm so thirsty. Let's go back and look what other remedy may fit more closely. And that's where you may need professional help for that if it's not, fitting on the totality of symptoms. Sometimes what we do, consumers do, is look at homeopathy like a horoscope. You say, oh, pulsatilla, oh, that's me, that's exactly me, but they forget, like in horoscopes or in astrology, well, your moon might be in Cancer, your house might be in this planet or that planet crossing the horizon. It's a much, much bigger study. But often you can just prescribe on that smaller totality and get relief. And you can so do that, and you can so get a good book. And I hope in your site here you'll put up some references of resources where you can get books to learn about it. And then you just start trying it as an experiment. And we do that with babies anyway and with ourselves anyway, right? We try this, we try that. We say, well, they don't like this. It seems like they don't like that. It's the same with anything. But this is a very easy, safe, gentle, non-toxic way to start to assist relief of discomfort.
Yes, for resources, I know MirandaCastro.com, her website has books that she's written and other resources. Also, what about the National Center for Homeopathy? That's a good
National
resource
Center
as well.
for Homeopathy is a good resource as well. Homeopathic Educational Services, Dana Ullman, he has written many, many books over the years. He has a wealth of knowledge of that. Homeopathic Medicine for Children and Infants is one of his earlier books, and it was one of my Bibles when I was bringing my children up. Homeopathy for Pregnancy and Your Baby's First Year by Miranda Castro, another one I love very much. And then there are many others, but those sites have Dana's site, Homeopathic Educational Services, has many, many, many books. They also have courses and tapes and different things you can take if you want to get more involved in it. But generally, I find when you're first pregnant, it's an overwhelming situation to begin with, and you take things little by little, and you start to heal yourself first and watch how that happens, and everything is a whole new experience in pregnancy, right? It's a whole new world coming up, and you don't know what the heck you're doing in that world, and you have to reorganize and figure it all out. So one step at a time is what I say.
Yeah, and if you're feeling overwhelmed, that's where, consulting with a trained homeopath would be helpful to just get some guidance.
And you'll see that as a practitioner when they come to you. You'll see you're adjusting them, you're doing this, you're doing that, and you see they just aren't comfortable with one or another experience or situation, and that's where we do integrative healthcare. That's where we refer to someone and say, talk to this person or talk to that person, whether it's a psychologist, a positive emotions, a cognitive behavioral therapist, people that we know there are expertise in every field. We don't have to just seek help when we're sick, diseased, and in crisis. We can form a network, a team of professionals that support us during every stage in our life. And this is just the beginning of stages.
Right. So we were talking about morning sickness remedies, but there's also remedies for other common pregnancy symptoms like heartburn, insomnia, constipation.
Right. So heartburn, of course, goes along with nausea sometimes, so you want to look at that. And one of the big remedies is pulsatilla. It's a very good remedy for heartburn, and that is, again, rich, greasy, fatty foods, which you crave and you want, but they don't make you feel good. And one of the keynotes that people will say is it's a sour burp. It's a sour burp, bitter. It could almost burn. And so, again, they feel better in fresh air. You want to look for the modalities. What makes it better? What makes it worse? I have a sour burp. Well, there are lots of remedies that have that. But what makes it better? What makes it worse? And then you'll say, well, I feel better if I'm out in the fresh air and I'm craving that. And you'll always go back to the moods. They're weepy, they're changeable moods, and they're clingy. The baby often will be that way as well. The pulsatilla children are very clingy and they don't want you to put them down, and they cling and they cry, and nothing you give them that helps them. They're very fussy. That's a pulsatilla. Sometimes, very often, when you have strong symptoms in pregnancy, the baby may have strong symptoms as well that fit the same state you were in when you were pregnant. I very often take the mother's case during her pregnancy when the child comes in to me. They have colic, they have sleep disturbances, mostly colic is the first thing when they're infants. And then I take the whole case of the mother and during pregnancy, and then I prescribe the case of the mother's remedy to the child. So that's always something to preview as a practitioner when you're treating a pregnant person is what state they're in, and how that when they bring their baby to tell you they have these issues, you're always going to remember what state they were in, and very, very often that's the case. So, again, I'm building a sort of macro and micro. We zoom into what you have right now, heartburn, and it's a pulsatilla case. I'm always going to zoom out in my macro lens, put that in my file, and remember that can be their child's remedy too. And it may be their remedy for after healing, after birth as well. They may have postpartum depression, very weepy, very blue, very, unsettled and gastrointestinal disturbances, then I'm also going to prescribe pulsatilla for that. Carbo-Veg is in my brochure. Carbo-Vegetabilis is a remedy for heartburn. It's got a lot of gas, a lot of painful, almost entrapped, or we call it incarcerated flatulence. You can't get it out, and it's very painful. That is an indication for Carbo-Veg. They also feel very faint, and they can't get enough air. They have fans blowing on them all the time. They need the air. They need it right in their face. Different from pulsatilla, who wants fresh air. Carbo-Veg has to have, unbelievable amount right in their face kind of thing. They're very, very exhausted, way more exhausted than a sepia. In fact, we call it the corpse remedy, the corpse reviver. Carbo-Veg is for people who are so exhausted they faint. In fact, if you're somewhere where somebody faints, as I was at a conference one time, they just faint. They're blue almost looking. They're totally out. Carbo-Veg will revive them instantly. So it's almost that state of complete collapse. So it's not a remedy I go to that as a first one, but it is something you could keep in your back of your mind. The other ones that I like, hemorrhoids and constipation, are, of course, hormonally related. So you know that when you're having hormones fluctuating, you're going to have a relaxation of the muscles in the pelvis, and it does slow down digestion. Also, the pressure on the organs, on the intestines, also gives a little bit of a motility, sluggishness. So again, sepia, love that sepia, that heavy sagging feeling. You do have the hemorrhoids, and so when you're constipated and have all of those modalities or several of the modalities, you feel like you're pressing like your insides are going to come out. You're urging, but nothing is passing, and you have the other symptoms, then you look at sepia. Homomelis, I love. Homomelis is actually witch hazel. And homomelis is a very good remedy for hemorrhoids that you're having that are itchy, very itchy. Remember witch hazel you put on a mosquito bite when it's itchy? Mm-hmm. So when you have hemorrhoids that are protruding, they can also bleed when you wipe, but they're really itchy, then you can use homomelis. I believe those pads that you tucks have witch hazel for hemorrhoids that itch. And so that you can take homomelis, it's called internally, that will help to heal them, and you can also sit in a witch hazel sitz bath for those hemorrhoids. You're treating inner and outer with homomelis for hemorrhoids, which is it's wonderful. They're protruding, they're pulsating, and they're itching. And also you may have varicose veins in the legs as well. So susceptibility, past history, current history, what were you like before pregnancy? Oh, I always have hemorrhoids, and they get worse around my menstrual cycle, or when I'm straining or eating the wrong food. So you know then that's a keynote, yes, okay, let's try homomelis for them. So I really like that one. Lycopodium is for very inflamed, aching. So you see, we're distinguishing about hemorrhoids and how they feel, the sensation and the function. How do they feel? One is itchy. That's not lycopodium. Lycopodium aches, right? And sepia has the ineffectual urge with straining that makes them come out. They're very, very different if you inquire deeply. And with lycopodium, they are the stools. It's about the stool. It's very large and hard. It's difficult to pass. So you might want to think about increasing your fluids. I like aloe as well. It's very gentle on the system, and it decreases inflammation. And you do have a lot of bloating and gas, of course, with lycopodium. But the bloating and the gas is happening because it's difficult to pass them. So it's stagnant, it's stagnation. And so that's one that I use for that. Of course, the temperament you're going to look at here with lycopodium, they're a little bit mean. They're bossy and domineering. They're tyrants, little tyrannical people. Lycopodium children are like that. They're bossy and domineering at home, but they're the sweetest kids in school. The teacher will say, they're so wonderful. They're so sweet. We don't see a thing of that. Well, that's because they have a fear of superiors or people higher than them, but they like to boss around and be dictatorial at home. So this may be that person too. The mom may be this kind of person who has that temperament, and then her hemorrhoids or her constipation will reflect that nature. And so you'll see that in hemorrhoids and constipation. The other thing, insomnia. I often see insomnia later, in the later stages. In the beginning, it's more about the nausea that doesn't allow you to sleep well. Then in mid-cycle, it can be the back pain. But at the end, the last trimester, insomnia is more prominent, I've seen, mostly because of the anticipation, the excitement. You know, you might be anticipating, my life is going to change, I'll never be the same again, etc. That's anticipation anxiety. I like to use different remedies for that depending on how it looks. The excitement at night, oh my goodness, I can't sleep because I'm all hyped up, like coffee. You know, when you drink coffee and you get so excited you can't sleep, so revved up you can't sleep. So when you're in that state, there is a remedy called coffea cruda, which is made from coffee. It's potentized coffee. So again, like cures like. If you feel that, you know, they might say to you, I feel just like I drank 10 cups of coffee. Oh, well, then you give coffee. Always listen to what they say, because people will tell you their remedy. They will tell you their remedy by the way in which they feel. So that kind of feeling, and they're exquisitely sensitive to any pain. So they may be saying, I'm so nervous because I'm anticipating the pain of childbirth. I can't take any pain. Oh, my God. Well, that's coffea, and you may want to give them coffea during the delivery, the labor process as well, or chamomilla, which is also very, very exquisitely sensitive to pain. And chamomile tea, we know, it calms you down and relaxes you. And it calms you down and relaxes you when you're the type of person who gets all jammed up like that and is exquisitely sensitive to pain. So going back to the insomnia that they experience at that time, look to the child who they're having. Will they be that child who you take to a birthday party and then they can never sleep again? Or that night, then you're going to give them coffea? Or are they the child who also anticipates and gets so gymmed up the night before that they can't sleep, jumps all over the place, wired? That's a coffea child. The other remedy, chamomilla, are teething children who can't take the pain. It's just starting to come in. They're flipping out. Ah! That's chamomilla. I remember giving it to my neighbor. We were having a Passover dinner and the child was teething, and she was out of her mind, screaming. Their face gets red. Often one cheek is red and the other one is pale in chamomilla. That's a good keynote, and the one that's red is on the side that the tooth is coming in, it's inflamed. But they can't take a dot of pain. And the same with that colic remedy. I gave her the chamomilla. Immediately she stopped. Immediately. And the behavior was out of this world. They get so angry. They throw things, anything you give them to try to distract them, they throw it. You give them the chamomilla. Come right down and started playing with the other children. So again, chamomile for women in labor, delivery, or any time during the pregnancy who exhibit those symptoms is wonderful, and look to the child who has that as well. And that may be an insomnia too. That's why it's not in this brochure, but we do take chamomile tea to settle ourselves down and go to sleep. May be the same thing. And again, the anticipation anxiety feature of insomnia. Aconite is one that has a lot of fears. Where there's fright, give aconite, is my saying. And that can be that you have a fear, you're going to die in labor. Remember, strange, rare, and peculiar. If the person says, I'm afraid I'm going to die in labor, it's rather strange. We have heard it. It's not uncommon. Most people are not afraid they'll die in labor.
Right.
So that, if they say that, remember about aconite. Restlessness, vivid, frightening dreams. And in that case, when they feel that way, I usually, again, delve back into that complaint. Go to the chief presenting complaint and go a little bit further into that. When have you felt this way before? What very frightening or event, or a fear of your life event have you witnessed or been subjected to in your life? And now we know we have a post-traumatic stress disorder, a susceptibility coming into play, and you really want to look at that. That requires constitutional treatment, and that will have some play afterwards often if the birth is very frightful or will bring back any traumatic associations. So that's a key to look at in their symptom, in their presentation. Remember how they say it, you'll know it's odd. If there's something odd about it, then you know this requires something more than just go to CVS and get this remedy.
Yeah.
And so that sort of brings us into the labor piece, what comes up during labor. Normally, labor is a normal process. You might feel like it will never end. It will always end. There's an end to labor. There's an end. You always have to remember that. Breathing in, there is an end. And there's back labors, which you can bring your chiropractor with you if you like, or you can train your partner how to work those muscles and do certain movements, rubbing and certain things. Some people will want rub it. That's a keynote for a remedy. And some people, get out of here. I hate you. I hate you for getting me into this position. That is also been said and done. And so those are all indications for remedies. It's really difficult to prescribe remedies during the labor process for two reasons. One is usually you are in a hospital, and that's not usually, number one, allowed, or number two, there is not a professional with you who can prescribe accurately. So often you're not going to have the opportunity to do that unless you bring with you a doula or a homeopath or homeopathic midwife who is using these remedies. If you're birthing at home, which I did and which I love and can't say enough about the beauties of, then of course you can do that all through the labor process. But I basically would just say to you as a chiropractor, calicarbonicum is one of the best for back labor because that's the worst pain you can have. And if they say, oh, you're having back labor while you're in labor, then you do want to give them calicarbonicum and they can bring it with them. And that's, the same one you may have treated them with during their pregnancy, that feeling of, the hard pressure. They'll say, put hard pressure over my back while I'm in labor. That's a very common desire. That's calicarbonicum. So you could say, if they've had that kind of pain, bring this with you and have your husband or your partner give it to you, no matter what they say, while you're in labor. That one I would have no problem giving. The other
Arnica is such a common homeopathic, too, and pretty well known.
Yes. So arnica the keynote for arnica is soreness. During soreness, and that's most indicated for afterbirth. After you've had the child, I always take arnica after because it's for swelling, bruising, and the trauma to the tissues. So while trauma doesn't mean bad, it is traumatic in the sense that you are having a very large, 10 pounds perhaps, baby come out of a very used to be small opening, and so you will have some tissue swelling and tissue, I'm going to say damage, but tissue bruising. And so I always take arnica after for at least several days, and you do dose that according to how much soreness you have. You may have to take it a week, 2 weeks, and that's fine. It's the number one remedy for any tissue healing. In fact, before I knew homeopathy and I had my children, the only two remedies I had was arnica and calendula, which is what, if that's all you have bringing up children, that's probably what you need, arnica and calendula, because arnica is for the swelling and the bruising, contusions of any kind, and calendula after birth is for any wound, any opening, abrasions, cuts. That's what calendula is wonderful for healing. It heals any infected wound. So if you've had an episiotomy, an incision, you'll want to take calendula, and you may want to put calendula cream on it. Calendula is also wonderful for any skin issue, diaper rash, sore nipples, any such thing. You want to use calendula. So healing after birth, those are the top two that I use and have always with me. Arnica is very important also remedy. It's called traumatic par excellence. Why? Because it works in every sphere of trauma, physical, emotional, and mental. And it is wonderful for the effects of trauma recent, like right now, and remote. So I'll bring up the word PTSD again, because sometimes we've had other traumas, and when you experience pain and this type of thing, it may remind you of another trauma you had, even though it's not the same. It may remind you of it again. Then you can take arnica for that. Memory of trauma brings back associations of another mental shock or trauma you've had. Then you can take arnica. That's what it is. My absolute favorite remedy in that sense, and it's really, really an important one to think of, because even though birth is a wonderful thing, it's a very traumatic thing, and it's shocking. Often you're not prepared for. Who is prepared for something like that you've never had before? And each pregnancy is different, and each birth is different too. And especially if you've thought you want a natural, and then you have to have a C-section, people are disappointed, they feel bad about themselves, they feel they are a failure, they feel guilty over it, they feel it was the wrong thing, or something went awry and they didn't have control over the decision-making process or time to think about it. They just had to go with it in a crisis moment. This is very upsetting for people, and it's shocking, and it's traumatic. And so you want to explore those feelings. There may be a more well-suited particular remedy for that, but you can always give arnica and see, what comes up. Then you watch the healing process and see the layers and see what they next speak about. The other one that I was
going to say is if a woman did have a C-section, the arnica and calendula could also be helpful for healing.
Absolutely. Well, healing is about removing the effects of the shock, the trauma, whatever happened to you. So, yes, that's how you assess it. Now, healing in a wound situation, in the skin, the episiotomy, the forceps delivery, well, not so much forceps delivery for calendula, but calendula will help to generate proper granulation tissue so you don't have scar formation. So you want to take it if you had any kind of incision, so that you have the right healing and the reduction of scar, and the tissues heal nicely, and also prevents infections. But for something like when you have the epidural, the episiotomy, any of those injections, hypericum, which is actually St. John's wort, it also has emotional sensitivity in depression, afterbirth type of things. You've heard of St. John's wort. That's hypericum. It's very about rich nerve endings. This is a wonderful for crush syndromes, but in this, close the door on your finger and it's crushed, hypericum, nerve endings. But also in epidurals, I've seen this really, really often. The injection sometimes you get leakiness afterwards, leaky in the spinal cord area.
Spinal fluid, yeah.
And you feel headachy or never well since in that area in the low back. They'll come to you and say, pain, I have headaches since I delivered, or I have pain in the area where the injection was. Hypericum is excellent for that. Any pain that follows a forceps or a vacuum delivery type of thing is important, and any kind of injection. It's pretty much characterized by shooting pains, sort of like a coccydynia. Coccydynia responds excellent as well to hypericum. And you know coccydynia is it's a long healing process with coccydynia. And any tailbone or perineum pain, hypericum is excellent. I want to just piggyback on arnica a minute, because another remedy for healing after birth is a daisy. Arnica is a daisy, mountain daisy. And Bellis perennis is also a daisy. So in the daisy family, it's another remedy that's wonderful for healing after birth when you have deep, aching, bruised soreness in the pelvis, that arnica is not helping with. So we have bruised soreness as a keynote for arnica. If you're not getting good relief from that, think of Bellis. It's more a deeper injury, more of a cesarean or one of those where they were pushing down, trying to get the baby out. That kind of a deep pelvic bruising pain, or that type of trauma, that arnica, it's a second, deeper remedy, a follow-up, Bellis. And what else do we know? Stephosagria, another plant. These are all plants. A delphinium. It's a larkspur. I love it. It's a beautiful flower. Stephosagria. That's also deep healing after surgical. It's deep incision, something from a knife blade incision to Stephosagria. And also, they're very upset. They have anger. They have shame and humiliation from the experience. And that also comes if they weren't ready to have a cesarean, and now they had to have a cut process of getting the baby out. It wasn't what they wanted. They're ashamed and humiliated, had to go in that direction, and they have wounds healing. It doesn't heal correctly. That's good. The cesarean's not healing right. It's the incision is wrong, and they have those feelings. That's definitely a Stephosagria indication. So again, it leads us back to thinking about homeopathy as not just symptomatic relief, but healing the whole person. And that's why individual classical prescribing is what I go for, because you can just take a remedy off the shelf combination, and it may or may not help you. And if you don't have anything else and you're in crisis, by all means try that. But what we really want to do is have conscious awareness of ourselves, our healing, our hurts, so we can continually do this through our life, and so that we can also intuit for our children. Because remember, they can't speak for 2 years. You have to try to figure out what do they want. What is wrong? That's what you have to think about, what's wrong with them. So your intuition is going to come into play. You're going to look and see and feel and intuit. Well, if I give them hot, they're better. If I give them a cold, if I walk them and bounce them, it relieves them. This is homeopathic prescribing. That's classical homeopathic prescribing. It comes naturally. Homeopathy is a gift. It's not just for one practitioner or professional. It's a gift for all of us to use. And when we need a professional level, we do have those schooled in it, but we can so understand it ourselves. We know it. Mothers will come to me with their babies. I'm sure they've come to you and they say, well, the doctor said it's this and give them this, but I don't think so. I think it's, what do you think it is? And they say, well, when she does this, but the doctor said to give her this, but I don't think, well, then you're right. You are right.
Yeah.
And then you hone your skills of prescribing for your child, and then you hone your skills of prescribing for yourself. That's what classical homeopathy is about. Again, not to poo-poo the combinations. They're there for a reason, and sometimes if you can't find a specific, you might just throw that in the mix and see what happens. And then go back into the ingredients on there, and if there are 1, 2, 3, 4, then go back to your books and look at it and say, okay, which one of these might have helped? You can do it that way, too. I don't like the combinations that have like 20 things in them or 12 things in them, because when you take a homeopathic remedy, that's not right for you and you take it repeatedly, you may do something called a proving. You may start to prove, I mentioned that earlier, that remedy means you'll get the symptoms of that remedy. So that's one of the reasons I don't start with a combination. I prefer to do the best you can with a prescribing on the totality of symptoms in front of you, and don't be faint-hearted on your path. To be a woman is not for the faint of heart. You have to carry on, persevere, and be persistent because you have a child now to take care of. Mm-hmm. And you are the primary caregiver. Even if you have caregivers during the day, the buck stops here. You're the mother. And that's your responsibility to set the tone, to set the pace, and to understand your child. So you can be supportive and nurturing and teach them how to heal themselves. That's what I love so much about treating children. They'll come in and say, oh, Dr. Nancy, I fell on my knee and it's swelling on this side and it's better if I put ice. They know what to tell me. It's adorable. Yeah. But they know how to understand themselves. And now, because I'm old, they're in college or graduated from college, or now we use FaceTime and Skype. So they're in college and they're sick and they have viruses or whatever. They Skype me or FaceTime me, and I treat them. But I know them. I know what they had the earache when they were this. I know that, and they know. And they say, I tried this. So, I took lycopodium or whatever. And I say, okay, but you were also up all night drinking, right?
Busted.
And that's part of the picture, too. But so what I'm saying is that homeopathy is for everyone because we begin to, we own the experience of who we are and how we grow and develop as humans. And each time we're going to be confronted with challenges or obstacles that may give us a symptomatic expression on mind, body, emotion, or spirit level. And we have to look at that and not say, oh, I just caught something and be totally disconnected from ourselves. But we say, oh, that's right. I was up studying all night. I drank coffee all night. And, now I'm exhausted and I'm shaking and I feel like I'm getting sick. And we know what then. Well, then we prescribe a homeopathic remedy and we say, oh, that's right. Maybe I'll do that differently next time. This is how we live the homeopathic principles. Like cures like, what's our patterns? What are our susceptibilities? And how do I fulfill that too so that I'm whole? And whole doesn't mean we're finished, right? We're not finished. Right. As long as we're alive, we're dynamic. It's a dynamic state of being. We're just always caring for ourselves and nurturing ourselves on our path. And we have that kind of thinking as relates to all our relationships. And in that way, we're all homeopaths.
Mm-hmm. That's so awesome. So the brochure that you were referring to during this podcast, how can women access this?
I wrote this many years ago when I was president of the National Center for Homeopathy. I do believe it is on their website. However, I am not sure if you have to be a member to download it. So what I am suggesting right now is that you go on the center, just type in National Center for Homeopathy and search around if it's there, Safe Homeopathic Remedies for You and Your Baby. If it's not there for easy access, then I would send an email and ask how I can obtain it, and they may tell you. There's a
sure info at National
a word to get it, or yeah.
Okay.
And that's the story of that.
Well, I love it. This is such a powerful tool to empower women during pregnancy, during labor, after birth, and even, with their children. Can you tell our listeners how to get more information on you with your website?
So you can just type my name in, drnancygahles.com, and what will come up is my blog and different information from my website. I am redoing it now. But basically that tells a lot about who I am and what I've done. There are some archived articles, archived radio shows. Maybe my TED Talk might be archived on there. Mm-hmm. My book is definitely on there. the power of self-care, which we love. That's what I'm talking about. The Common Sense Guide to how you can create your own healthcare solutions. My whole life of service is about empowering people, as you probably can tell from this talk, to be there for themselves. We are definitely able to stand up for ourselves, to speak out for ourselves, to work in collaboration with our healthcare. We don't have to give it over to someone who does something to us that we don't know what it is, and we do it anyway. No, we can be conscious creators of our lives. We are conscious creators of our lives, and we are in relationship to everyone. We're in co-creators. So you know when they come into your office, you work with that person. They don't just come to you, and they walk out the door. You work with them. I know you do, as whole people. And that's my passion in life. I'm a passionate patient advocate, person advocate. And you can look on my website for that, read my book. I also do, as I mentioned, teleconsultations. That's my favorite thing. I've been working in the area of telehealth for many, many years, and it is the cutting-edge new way of seeing your doctor. Since I'm not a medical doctor, I don't have to examine you and prescribe drugs, but I can do a consultation with you over Skype or FaceTime, and I do have a blog all about telehealth. It's called allaboutTelehealth.wordpress.com. And there you can read about telehealth and how we can have consultations over the phone, just like the one we're having right now.
That's right. So if someone needs to find a trained homeopath, even if they live in the other part of the country, they can contact you through your website and schedule a telehealth consultation.
Absolutely, and there are also within homeopathy, just like in the medical world, specialists, doctors of homeopathy, doctors who have homeopathic in their practice, like chiropractors who focus on homeopathy for back issues or neuromusculoskeletal issues. There's also homeopaths who specialize in many other areas, so I can also direct you to that. One thing I would like you to know is that there is a certification for classical homeopaths that is very rigid. It's a national examination. It is you have to have several years, 4 years of study, pass an exam, have internship and clinical rotations. It's very, very powerful. That's how you know you're getting an experienced, well-trained homeopath, and that is the CCH that you find after my name. It means Certified Classical Homeopath, and the organization that certifies these homeopaths is called the Council for Homeopathic Certification, chc.org, and they have a practitioner directory. But the issue is, as with primary care providers now, there are a few of them. There are not many of them. They, however, are able to practice through Skype and FaceTime. So we can have a practitioner anywhere in the world and have what you need. The world is our oyster.
That's wonderful. And I'm just going to spell out your name for the website. It's Dr. Nancy, Nancy, Gahles, GAHLES.com.
And you can also get me at Ask Dr. Nancy, ASKDR Nancy, at AOL.com. You can email me anything you'd like to ask me, and I'm happy to help you.
Dr. Nancy, thank you so much for coming on the show today. This was so enlightening and inspiring and empowering. I love it.
Well, Dr. Laura, I love you. You are a woman of courage and innovation and one of the finest chiropractors I have had the pleasure to meet, and it's been my honor to be here with you.
Oh, thank you so much.